Dr. Trevor Elmquist, and I'm an ophthalmologist here in Lee County, and we've been coming to Shell Point for a little over 12 years now. I initially got into the Air Force as a medical student. The true story is that my wife got pregnant as I was a first-year medical student, and she wasn't able to work, and we needed some funding. So I signed up for the military, and the Air Force was the one that accepted me, and they pay for medical school and your training, and then they require an obligation of active duty as a physician for the next few years. So I was based initially at MacDill Air Force Base. I was called a flight surgeon. I was assigned to a squadron of F-16s, and they were for training purposes. And about once a week I'd go for about a 1-hour sortie and fly with the pilots of the squadron. I got kind of famous after a while for being airsick. And actually it kind of got all over base. It's an interesting story with one of the dentists at the hospital would drive by my little duplex. I was right in a small duplex on the way to the hospital, and he would stick his head out his little sports car and go, "Bleh," just giving me a hard time. And it was kind of a fun joke, but after a while it really got difficult, and my first 15 rides in an F-16 I actually got airsick. So it was getting a little dicey there of whether or not Elmquist could stand up to the rigors of an F-16 flight. So the squadron commander and the base commander as well as the wing commander all agreed that we're going to give Trevor Elmquist 2 rides in an F-16 at the government's expense to get him up and down to the ground without getting sick. So we got a little acclimated there with those 2 rides, and it worked out fine. So after a while I was not getting airsick anymore. And then I went on to training at Walter Reed Army Medical Center as an ophthalmology resident. One of the things about Walter Reed, it was a referral center for the entire world and for the entire Army. It was kind of the central location. So very difficult eye problems from all over the world were sent eventually to Walter Reed, whether it was an unusual cancer of the eye, trauma to the eye, or some kind of inherited disease of the eye. And as you can imagine, just literally millions of active duty and families and retirees. Walter Reed was the center of Army ophthalmology. There were many success stories, and I'll tell you, my first cataract surgery was what's called an extra cap. It's kind of an old school thing now. I mean, the changes have been dramatic over the last 30 years. So this is about 30 years ago. We took 4 hours to do a cataract. Now we do them in about 12 minutes. So, but that was a success. The patient saw better, and things just got better after that. There were some significant success stories related to some very, very sad cases, like cancer in the eye in young children. But to be able to actually, say, remove the cancer and have the second eye or the fellow eye be a visible, vision successful eye for the rest of their life, and save their life, basically. Those are kinds of success stories I'll never forget. I stayed on active duty for 2 years after my residency, which I went on and moved to Homestead Air Force Base. So at Homestead Air Force Base, I was the chief of the eye clinic. I had 2 optometrists with me and a staff of about 3 or 4 technicians. And we did general eye care. We did cataract surgery, we did strabismus surgery, we did families, and just general eye care for retirees, glaucoma. Had some interesting cases there. One lady came in and she'd been followed by some other eye care practitioners for glaucoma. But I looked at her and it was only one eye that had glaucoma, and it seemed like her pressure was fine. So we really investigated her a little bit more and found that she actually had a benign tumor behind her eye resting on the optic nerve, causing a situation that looked like glaucoma. She had that removed, her vision improved, and she really did well. At Homestead, I finished my active duty time, which totaled about 8 years in the Air Force. And then I went on to private practice here, initially in Cape Coral, but in the Fort Myers, Lee County area, and we've been here ever since. But I look back and I'm really thankful for my opportunity to be not only in the military and wear the uniform, but the training is just fantastic. So I will always say that I had such a fantastic experience in the military, and I look back with a great deal of pride. And I'm very pleased to say that we have 3 eye doctors in Elmquist Eye Group, including myself and Dr. Kate Wagner and Dr. Eccles Brown. Both of those young ladies came from the military as well. Dr. Wagner in the Army and Dr. Eccles Brown in the Air Force. So we all practiced our eye care profession in the military, and I know they're very proud of their military experience as well. Well, Veterans Day, of course, is a time to reflect on the people who really did sacrifice, and I will say that was not me. I just had a wonderful experience, and I do not call it a sacrifice, but there are a lot of men and women who have sacrificed in the past and given the ultimate sacrifice of their life for this country. You know, the thing is, our country is a land of freedom and opportunity. Those 2 words ring true for me, and I think military and the military veterans really exemplify what it means to be free and to have opportunity in the United States, and that's what they sacrificed for.